I want to speak up before more of you non-ODs wind up in the morgue or left with permanent brain damage from oxygen deprivation, not even knowing your own names, 24/7 nursing. Gosh, this is your tax dollars. Millions eagerly following the wrong instructions. You could be next, or anyone. Think. First time in 10 years I've had the Works Toronto Public Health admit to what 10 million references say in the medical literature they've been teaching wrong since 2011. Huh. Well, that's strange because the signs that are up on the webpage, that proves you're alive. Could be any breathing emergency.
What are you comfortable with?
Well, you know, you've got an overdose prevention site right next door, and the nurses are given oxygen. Yeah, they're wearing PPEs because of COVID. But see, you're teaching this to laypersons, and I live at Yonge and Finch, and it's very busy there 24/7, a lot of people.
Is there a lot of overdose in your community?
Well, there's overdoses anywhere, you know, poisonings, children. I'm showing up on scene, parents giving their live children non-drug overdoses chest compressions. A child fell off its bike and knocked himself unconscious, and the mother's given chest compressions. And then another time, a gentleman's having a seizure, and the father's giving chest compressions. Another time, just down the street at the Loblaws on North York Civic Center, a guy fell off the stairs, blood coming out the back of his head, he's unconscious, and his friend, 250 pounds, is pounding on his chest, going, "Nigel, Nigel, Nigel." So I had to pull him off. Nigel was still alive.
You don't give anyone compression when he's still breathing.
That's right. Yeah. You know.
Chest compression is when you're not breathing. They start to resuscitate. That's what
yeah.
Breathing, you don't even give chest compression at all.
That's right. But millions of people have been taught wrong. I don't know. See, I got a letter from the executive director at Health Canada.
Okay.
Yeah, Heidi Jackson, September 2018. Health Canada removed rescue breathing from their overdose protocols. September 2018.
That's a long time ago, I know.
Yeah, it's not good.
I think a lot of people I know are aware, or maybe they just don't care. I don't know what to tell you, but maybe they need to do more research. So
Well, there's research. Anesthesiologists, they overdose people on many different substances, and then they immediately give you oxygen during surgery. The evidence has been out there. There was a coroner's inquest, Bradley Chapman, and Aaron Orkin, he was one of the guys that's saying chest compressions, giving testimony. He said it's rescue breathing, because it's pretty hard not to tell the truth when you're giving testimony and the judge is an MD. You couldn't even you couldn't pass an entrance exam to medical school not knowing about respiratory failure.
Yeah, because that's the basics actually.
Yeah, I know. And do you know what? These nurses that are teaching it and stuff, they know it's wrong. So it would make them physically and emotionally ill. You know, the exact same thing happened in Nazi Germany. Under Hitler's orders, It was the doctors and nurses that started the Holocaust. They would, yeah, they started with children that had disabilities. So they would overdose them on drugs, stick them out in the freezing weather, or starve them to death. That's where the Holocaust started. There was massive amounts of propaganda to get rid of people, you know, pure Aryan, right? Yeah, you can look it up. It's on the Holocaust Memorial. It's called Caring Corrupted, the Killing Nurses of the Third Reich. The Holocaust Museum in the United States. What's his name? Jerome Adams? He was the Surgeon General of the United States of America under Trump. On the radios, he's being interviewed, and he says if it's an anaphylactic shock, a drug overdose, a diabetic coma, or hypertension, give CPR. The reporter twice. Doesn't that cause harm? He's an anesthesiologist. Yeah. Medical doctor. And when you tell laypersons, you know, they're going, oh, that's the Surgeon General. He must know what he's talking about. I phoned the White House once. Yeah. You get Secret Service on the phone when you talk to the White House, eh? Every Secret Service agent has first aid and knows what they're doing is wrong. A minute and 30 seconds into the conversation, you hear plain as day, Bill Blair. Yeah, they called Bill Blair, head of Canada's Homeland Security. Huh. I was on a webinar with Homeland Security and EMS. Homeland Security has a training video. They teach the proper way to save lives. Anyway, buddy, I'm just trying to make awareness. We should get after the new medical officer of health for the province, Keenan Moore. Yeah, write him a letter. Yeah, man, I'm just trying to save lives because it could happen to anyone, an injury or illness that put you comatose, right? Yeah, and it's all through the Bible, you know that, eh? About rescue breathing. Have a good one, my man.
You too. You take care now.
Yeah, you too. Bye-bye. Public health. Hey. This teaching backfires in 1,000 ways you could never possibly dream up. Think, speak up, save your own lives. Medical information in comment box. Sean Hopkins, manager of the Works Toronto Public Health, been teaching chest compressions since September 2011. Heart and Stroke wrote her a letter 2013. Stop teaching that. Dangerous fool. Get herself killed if she suffers any of the 100 medical conditions that rescue breathing only is essential. She taught enough people how to do it, and they're eagerly following her orders.